Hello, I am here with our naturopaths, Dr. Moral and Dr. Lisa, and we are going to be talking about their approach to chronic pain. So, I'm going to go ahead and start us off with the question, how do you approach chronic pain?
Yeah, I can start. Yeah, basically always start with obviously getting a full history and exam and kind of getting the whole story behind how the pain started. Was there an injury? Is this a chronic autoimmune condition? And then we really use that information and in kind of the full history to determine what the underlying causes and triggers would be. And so always kind of taking a holistic approach and looking at the whole person to determine the sources of inflammation. And so, helpful tools are looking at somebody's nutrition status, looking at their exercise plan. Sometimes we'll run nutrient levels, hormones, and always looking at like sleep and stress and other things that can increase inflammation and maybe increase those flares from time to time and try to mitigate that. So that's kind of how I approach chronic pain with a new patient. It's always very individual, of course. So yeah.
Mm-hmm. Mm-hmm.
Yeah, I agree. I agree with Dr. Lisa. It's with chronic pain, it can be kind of challenging to navigate, especially if there's still like the underlying cause needs to be kind of determined, and or if the person has been struggling for a long time, it can evolve into a emotional kind of, physical, emotional, and a spiritual connection with all of it, because it really does, embody your day to day. It limits your physical activities. And so we really have to kind of, work from where the person is at and meet them, start with a reasonable treatment plan and then work towards their goal, which is kind of, individualized per person, right? Because both two people could have, a chronic pain situation with the same kind of pain, but the treatments that they respond to and the underlying root cause could be completely different.
Mm. I'm really appreciating hearing everyone's approach and just how true it is, how unique we all are, how individual we all are, and just the power of really listening to that and honing in um, to each client. How are you seeing the impacts of COVID affecting your clients with chronic pain?
Yeah. In in my opinion, I feel like COVID has really added a challenging layer for everyone, but especially for clients with chronic pain, because of the social, the emotional, and the physical impact, right? So socially, we've been isolated. We haven't been able to, see family members to the capacity we used to be able to socialize with our friends, which really does take a toll emotionally, right? And we know that your emotional wellness and your anxiety and your stress levels and depression all affect your chronic pain levels. And so when we add that kind of, and it's the amount of time this has been going on, I can't believe it's almost been a year, but having this kind of, roll around for a year and having clients really have a difficult time kind of navigating this. I'm seeing a lot of worsening in chronic pain. And not only that, but the physical modalities have really been limited, right? So a lot of people use, their physical therapists and their chiropractors and their massage and exercise. And that was limited for a while. And so I think what was happening was a lot of people were in that fight or flight, right? Like, what do I do? Like, my whole protocol, has been put on hold. And so just kind of figuring out the new norm, I think what is challenging and will continue to be a challenge, but, we're entering a little bit of a different, things are opening up again. We can start utilizing resources. But definitely COVID has added, I think, a kind of extreme layer to all of this, right?
Mm-hmm. Mm-hmm.
Yeah, I think the stress component, like you were saying, Dr. Morale, is probably the biggest impact that I'm seeing in the last year, because we know as stress levels increase, inflammation goes up and then pain follows. And a lot of people, their lifelines are massage and acupuncture, any type of body work, and not feeling, as safe the first few months. For sure, we're seeing more pain. I know, like, my treatment plans over the last year really, number one is stress management plans and making sure people are doing their breathing practices and meditation and positive visualizations and things like that. And it's become probably a bigger part of our treatment plans in the last year. I've also had a lot of patients in the last year where working from home, their whole ergonomics are different, their routine is different, and that can make a big difference for people with chronic pain. And so kind of looking at, what's your workstation? Are you moving your body? Are you getting up every hour? Are you drinking lots of water? So it sounds basic, but I've seen, that kind of work from home transition be a little bit harder on my chronic pain patients. So
Absolutely. Absolutely. That makes so much sense. What have been some of the most successful approaches that you've used in lessening and preventing chronic pain? And I know you've mentioned, what your approach is, but if there are some things that are a little bit more specific that you've really seen success with.
yeah, I mean, I think utilizing our bodywork resources, like we were talking about, looking at sleep hygiene, the stress management, and exercise plans, and that part is always individual, right? So sometimes it's actually reducing their exercise and looking at a safer, more gentle exercise plan for our patients, especially when they're in a chronic pain flare. I use a lot of nutrition in my practice, and I know Dr. Morrell does as well. So looking at an anti-inflammatory nutrition plan. Sometimes we'll use, things more specific like an AIP or Walls protocol, or things that are really more specific for reducing inflammation. Treating the gut and looking at food sensitivities and, doing testing and treatment that way, which maybe isn't always the most intuitive, but I see that that's a big source of inflammation for a lot of people. I tend to use a lot of anti-inflammatory herbs, so are good, like turmeric and boswellia and green tea extracts and things like that. And another one that I've really been using a lot more is low-dose naltrexone, which, we could probably do a whole talk on just that, but that can be a really good way to mitigate inflammation too. So there's so many things. It's always individual. It's, we could go on and on, right? But those are kind of some probably more common things that I use in my practice.
Thank you.
Yeah, definitely. I mean, I would agree with Dr. Lisa. The the list is quite large. And so I would say that's kind of one of the advantages though, right? To having kind of, that functional medicine approaches, we do have a lot of resources to use for people. And in my findings, people respond to different things, and so sometimes people really respond well to herbs, and people really respond well to low-dose naltrexone. I've had a lot of really interesting cases who've actually shown remarkable improvement with fasting. And so I would say nutritional, that's kind of one of the other things that we do utilize is fasting, intermittent fasting, especially because it can lower substance P, which can cause chronic pain. But yeah, I also do agree with Dr. Lisa, like really focusing on the gut. I know it kind of sounds it's like, why my gut? But your gut actually has a whole microbiome that mediates, your neurotransmitters, your levels of mood and inflammatory markers. And so we really focus on kind of cleaning the gut up, because once we do that, we see a lot of improvement in inflammatory markers.
Mm-hmm.
So I would say that's probably a common treatment for everyone with chronic pain, right? Looking at the gut and seeing what's going on in there.
Yeah. Yeah. Makes so much sense. Just hearing what resource you have and just the many avenues that you provide clients, I think it's even just offering the reality that we are these, intricate beings, these multifaceted people, and there are many ways to approach our healing, can be healing in and of itself. So I have two more questions for you here. What do you feel is the most important thing for people to understand about chronic pain?
It's a good one. Um, I really think a good kind of takeaway from this is that chronic pain is not linear, right? There will be times where your pain will be really well managed and you'll feel really good. And there will be times where there's flare ups or just, when you don't feel the best. And I think the most important thing I tell my clients is, you have to break the cycle of the stress response, right? Kind of that anticipation of pain. When's the pain going to be the worst? How do I prevent the pain? Now I'm in pain. What do I do about it? Right? Because essentially what a lot of people do is they anticipate pain that hasn't really even hit them yet. And what they're doing is they're stuck in this cycle of like, what came first, the chicken or the egg, right? um, Even when their pain's really good and well managed, they're so worried about when they're going to be in a flare up, right? Is it going to be when I'm on vacation and I have things to do? And so that alone can be a really detrimental cycle that we have to work on. And it sounds easier said than done, but really getting yourself out of that cycle is very, very challenging because part of it is human nature, right? Your fight or flight response kicks in for a reason. And so we do a lot of work around that, and sometimes it's psychotherapy. We do like Lamisha does lens neurofeedback, any way where we can disrupt the brain cycling and kind of create neuroplasticity, because I see a lot of improvement in people perceiving that they have less pain, right? Whether or not they have pain, but just imagining that they have less and breaking that cycle, right? Because there is, believe it or not, a brain response that can control how much pain perception there is, right? And so it's an interesting look at the brain, but really I think that's a big takeaway, is breaking that cycle.
Yeah, I agree. And I think, part of that is, I like what you said about kind of knowing what to do if they are in pain, because I think that can help reduce that kind of anticipation and the stress around that chronic pain cycle. So I think having a really good care team and having kind of a backup plan if you are, kind of seeing those early signs of a pain flare, and knowing when to reach out, how to reach out, and kind of already having a plan in place for if and when that happens. So yeah, I totally agree. And I think that just knowing what your resources are and knowing what your own triggers are and reaching out whenever you need.
Mm-hmm. Yeah, that final question it makes it so clear why so many practitioners are so inspired to work collaboratively. And so much of what inspired Kendall's vision about Vancouver Wellness Studio and why we're all here, just because that we understand the benefit of that multiple disciplinary approach, and also just the healing nature of community and people recognizing the complexity of pain. And it's just,
Yeah. We say it all the time, like a lot of our patients, when they start to see multiple providers and start to, utilize the mind, body, all of it, just get better quicker, right? And so having that resource here, I feel very fortunate because I know what a great team we are. And especially, when I do refer, it's like, I know that they're in good hands, right? And so
it's such a powerful, I think we're answering my last question here, but what inspires you about this work? What I think it's working alongside you guys definitely inspires me in my work. But I'd love to hear more about what inspires you.
Yeah, I think what I get really excited about is hearing, I always love hearing people's story, and then, when they are improving, hearing about how they're able to do things that they've always wanted to do, and not living in fear of their body anymore. That's what I get really excited about, and is so motivating to hear about hobbies that they're doing or physical activities that they maybe didn't think they could do, or that they can go longer or farther. And those stories are just inspiring to me.
Yeah, I would have to agree. And I would say the one other thing that really kind of, melts my heart always is when people just, they know their bodies and they know how that they're in control of the situation, not the other way around. Getting to the other side may not be, easy per se, but once you kind of reach that threshold and you realize, yeah, like I'm in control, right? Not fearing the pain, is it's really rewarding, because people's outlook, I feel like, completely changes, right? They're willing to try new things, and they're different with their family members, right? And their responses are different. So it's just so enlightening to see that, because yeah, it's getting better.
It was absolutely delightful talking to you both. Thank you so much for taking the time to talk to me about chronic pain.
Thank you, Crystal.
Take care.
Bye. Have a good
Bye.
day.
Bye. Thank you for joining Dr. Moral and Dr. Lisa and I. If you have more questions or you feel really inspired to reach out, please do so. You can schedule a free 15-minute consultation with each of our providers on our website at vancouverwellnessstudio.com. Thanks.